Next, we'd like to have Michael Pernick come up to give us a talk on the patient voice and looking into the future. Let me tell you a little bit about Michael, who's sitting right there. Michael was born with tetralogy of Fallot and became actively involved with the ACHA in 2011, shortly after his third open heart surgery. After a few years of working in politics, Michael attended law school at NYU and is now a litigator at a global law firm in New York City. And for years, Michael has been involved in the ACHA's advocacy work in Washington, D.C. And just last week, Michael joined 3 United States senators in Washington, D.C. at a major national press conference addressing the dangers of the House Health Care repeal bill. Michael spoke on behalf of the congenital heart disease community, not just the adult congenital community, but the entire congenital heart disease community, about how the bill places all Americans living with CHDs at risk. In addition to his advocacy work and efforts, Michael is a heart-to-heart ambassador and also a member of the ACHA's board of directors. So please come on up, Michael. I'd love to hear what you have to say.
Hello, everybody. Thank you very much for that introduction. Before I begin, I just want to say that my views are my own. I'm speaking on my own behalf as a patient with tetralogy of Fallot. I'm not speaking for the board of directors or ACHA in an official capacity. So I was born with tetralogy of Fallot. I've had 3 open heart surgeries. I grew up on Long Island in New York. My family worked very hard to give me a normal childhood. In fact, my grandparents, who have been an amazing inspiration to me, are actually here. Grandma, Grandpa, you're right in front. Why don't you give everybody a wave? Always been my biggest cheerleaders. I'm so lucky to have an incredible family, but I still grew up with constant reminders that I was different. As a child, every time I went swimming, I wore a shirt to hide the scars on my chest. Every time I would go to a park or try to play sports, the breathlessness and fatigue would hold me back. Growing up, I knew that I would have surgeries in my future, and I knew that life was precious. That's what drove me to work harder and study more and try to achieve more. That's why I got involved in politics and started managing political campaigns. After a few years of that, I went to law school, and now I'm a practicing attorney in New York. But let me take a step back and talk about how I first became involved in ACHA. Shortly after my 3rd surgery, when I was 22 years old, I moved to Boston just for a couple of years. I was away from my family, away from my doctors, on my own in a new city. On my first day in my new job, I started to get sick. Turns out I had endocarditis, but I was lucky. We caught it early, way before any permanent damage. While I was in the hospital recovering, for the first time in my life, I took ownership of my own care as an adult. That's when I discovered ACHA. I went to my first advocacy day. Like so many of us, I met Paula Miller, who welcomed me with open arms. Literally, she just gave me a big hug the moment I met her. I started going to advocacy day every single year. I became a heart-to-heart ambassador, and a couple of years ago, I joined the board of directors. In the 7 years that I've been an active member of this community, we have come so far. The advancements in medical technology and new procedures just amaze me. They're radical and impressive. And the structural changes that we've made to the way in which we provide care have opened up so many new opportunities and really changed the landscape for all of us, from board certification to the accreditation program, which is just such a game changer, as we've all heard this entire conference. But in spite of all of this progress, the CHD patient community as a whole faces monumental challenges. I want to take a few minutes to offer 2 of my thoughts on some of the biggest challenges that we as a community face. First, loss to care, and second, dangerous federal policy. And I want to talk about how, working together collaboratively, we can overcome these issues. So challenge number 1, loss to care. I was almost lost to care. When I moved to Boston, I had no plans to see a CHD doctor. I would have probably fallen out of care, and it would have been very dangerous. It wasn't until I got sick with endocarditis that I went to Boston Children's and met Michael Landsberg and Michael Singh and Michelle Gervitz and all of the people that we see here today. I'm one of the lucky ones. Only 40% of CHD patients are in care. Even those who are not entirely lost are not seeing the right doctor. 10% of adults with CHDs actually see the right specialist. This is scary, and we need to fix it. Challenge number 2, dangerous federal policy. We have leaders in Washington who are pushing policies that would be extremely harmful to CHD patients across the country. The House Healthcare Repeal Bill will allow insurance companies to discriminate against us. It would bring back annual and lifetime limits on our care. Now, the bill passed the House, but we can work together and do everything we can to make sure that it does not pass the Senate, because it has not yet become law. Now, this isn't to say that we haven't made monumental strides when it comes to federal policy. We have. I'm sure that Jerry's going to talk about this in a lot of detail later on in the session. The Congenital Heart Futures Act is a huge victory for everyone in this room. It shows that we can actually achieve our advocacy goals when we come together. That's how we've been able to successfully achieve funding increases year after year after year. But that funding is just a drop in the bucket of what we actually need. Funding for research and nationwide surveillance still lags far behind where it should. This is dangerous, this is deadly, but together we can fix it. These are not new issues. Many, many people in this room, myself included, have spent a lot of time working to fix these issues, some for far longer than I've been involved. Why haven't we been able to solve this? Why are millions of patients lost to care? Why is there such a lack of awareness about the importance of seeing the right doctor? I don't have all the answers, but I do know that we have struggled because we are tackling these issues with our hands tied behind our back. Relative to other nonprofits supporting diseases with equivalent prevalence rates, ACHA is drastically underfunded. And when we talk specifically about education, awareness, and advocacy work, we are part of a crowded space and a fractured nonprofit space that makes it impossible for anyone to really get their message out. We have the American Heart Association, which does good work, but does not prioritize the millions of Americans born with heart defects. We have a lot of pediatric groups who are inspiring and passionate, but they do not prioritize the message of lifelong care. And as a result, it is so difficult to raise awareness, effectively advocate, and work to solve the 2 big challenges that I'm talking about today: loss to care and dangerous federal policy. Our efforts are hampered because there are inconsistent messages coming from different organizations, and our efforts are limited because we lack the financial resources for our advocacy and communications programs. When politicians, policy leaders, reporters, or others need to talk to someone about CHD issues, who do they turn to? It's so confusing. Sometimes they connect with one of us, and that's amazing when it does, but more often than not, they don't even know who to turn to. Do they turn to us? Do they turn to a pediatric group? Do they turn to AHA? Most of the time, they'll end up talking to nobody. Public awareness campaigns and political advocacy are not easy. But as a result of this fractured and underfunded nonprofit space, it makes it all the more difficult for us to fix the challenges that I'm talking about: loss to care and dangerous federal policy. So let me give you 3 examples of how this plays out, why this is so difficult. The first example, back in February, Fatemeh Rashad, a baby girl from Iran, was planning to come to the US for an open heart surgery. But by virtue of where she was born and her family's religion, she was caught up in the president's travel ban, and she wasn't able to make it until politicians and advocates and other leaders intervened. My law firm, by the way, covered her expenses and legal costs. Thank you. There was a lot of press coverage of the story back in February. By show of hands, who remembers this story? As we all saw, lots of the press coverage talked about CHDs, talked about childhood surgeries, talked about amazing surgical advancements, but not one story mentioned what would happen when Fatemeh would grow older. The second example, who here saw the coverage of Jimmy Kimmel's son, Billy? Every single hand. Now, keep your hand up if you saw any mention in the media of the fact that Billy would need to see an adult CHD specialist as he got older. Not a single hand. Oh, I saw one hand. I'm interested in that article because I missed it, and I was reading them all. This was a transformative moment in CHD awareness. Many, many people across this country know that CHDs exist now who didn't know that before, and that's a really good thing. But our challenge is lost to care. The critical message, the message that saves lives, is the fact that we all need lifelong care, and that message was lost. A third example. Just a month ago, I got a call from Senator Chuck Schumer's health policy staffer. And she asked me if I knew anyone who can talk about the impact of the healthcare repeal bill on those of us living with pre-existing conditions. She said maybe she would call the American Heart Association, maybe she would reach out to, in quotes, one of the heart defect groups. But she knew me because I had gone to Advocacy Day every single year, and for the last 3 years, I had met with her and I built a relationship with her. As a result of that phone call, we were asked to participate in a press conference discussing and criticizing the healthcare repeal bill that passed the House. So I went down to DC and I joined 3 US senators in front of a lot of TV cameras and reporters. It was kind of scary. I talked about the importance of lifelong care. I talked about how ACHA is the leading nonprofit in the country fighting for the millions of Americans born with CHDs. And I talked about how a specific provision within the healthcare repeal bill could bring back annual and lifetime caps on coverage for all of us. This was an extraordinary opportunity for the CHD community. I've never seen CHDs as part of the national dialogue when it comes to healthcare policy, but for the first time, national policy was discussed through the lens of the impact on all of us living with CHDs. If it wasn't for my relation, that's a big moment. But we almost didn't have that opportunity. We almost lost it. If it wasn't for the fact that I had gotten to know this one staffer through Lobby Day, they would have reached out to somebody else or no one at all. So, to sum up, the fractured landscape and lack of funding in the CHD nonprofit space is a real problem. It makes it difficult for us to raise awareness. The media, politicians, and others don't know who to turn to when they have a CHD question, and they often turn to nobody at all. And it makes it so difficult to really tackle the two challenges that I'm talking about, loss to care and dangerous federal policy. But it doesn't have to be this way. When I close my eyes, I imagine how amazing it could be if we could fix this. I can imagine a world where every CHDer in this country not only has access to care, but is actually being seen by an ACHD specialist in an accredited program. I can imagine a world where every CHDer can have access to an ambassador who can provide them with the support that they need. I can imagine a world where every pediatric cardiologist, every general practitioner, every specialist understands the importance for every CHDer to have lifelong care with the right doctor. And I can imagine a world in which our elected officials not only know about us, but are scared of us. They know that if they vote, they know that if they vote to allow insurance companies to discriminate against us, we will vote them out of office. They know that if they vote to bring back annual or lifetime caps on the coverage that we need, we will vote them out of office. And they know that if they vote to slash funding for life-saving CHD research and critical surveillance, we will vote them out of office. I want a world where our leaders not only know us, but are scared of us. So, how do we get there? How do we find the loss to care? How do we engage our leaders so they act in our best interests? The answer is right in this room. Take a look around. I'm not just saying that. Actually, look to your left. Look to your right. Look at the people in this room. We have hundreds of brilliant medical professionals who have devoted their lives to serving those of us with CHDs. We have patients and family members who are community leaders in towns and cities across the country. And we have the best staff of any healthcare nonprofit in this entire country. Let's give it up for the staff. But we have so much more work to do, and I know that we can do it. Advertising campaigns and press coverage is really important, but nothing replaces person-to-person communication. So I think we have 510 people at this conference. And that number, 510, I think it's a magic number. If all 510 of us make it our mission to spread awareness, and we each recruit one new person a week to join ACHA by signing up for emails or joining us on Facebook, within 1 year, we would have recruited 26,000 people. And if each of those 26,000 people that we recruit post about the importance of lifelong care on Facebook, even just once, or mention the importance of lifelong care in their communities, we would have reached millions across the country. Now that's awareness. Think about this. There are 435 members in the House of Representatives, 100 US senators. That's 535 members of Congress. I'd say roughly 25 truly know us. They know who we are, they know the importance of lifelong care. That leaves 510 members of Congress who don't know that we exist. There's that magic number, 510. If we each connected with one member of Congress, just one, we will have educated the entire United States Congress on our issues. We have the power right here in this room to overcome our challenges as a CHD community. I know it because we're doing it. The medical professionals who are taking care of us, the ambassadors and advocates who give so much of their time and passion, the donors who provide the resources to make it all happen, and the patients and family members who are attending their first conference and joining our community. We are doing it right now. So here's what I ask. When you go home and reflect on this conference, ask yourself one question. What else can I do to help? Thank you.
All right. Well, this guy needs to run for office and be my lawyer.